Good evening. Thank you for joining us. I'm Dipti Itchhaporia. I'm an interventional cardiologist at Hoag Hospital and director of disease management. And this evening, we have a great program for you talking about a healthy lifestyle means a happy heart. So let me introduce to you are my two colleagues that will be joining me. We'll start with Dr. Richard Blankenbaker. Dr. Blankenbaker is also an interventional cardiologist. And the next person that I want to introduce to you is Dr. Bassi, Dr. Nikhil Bassi. He is also a cardiologist. The three of us work together, and we're going to have a great conversation this evening with all of you talking about habits for a healthy heart. So I want to start off by having them both appear with me on the screen. And then we're going to go ahead and start our discussion. But, you know, as they're coming on, I think what I'd like to do is talk to you a little bit about heart disease and the sort of magnitude of heart disease. As you all know, heart disease is the #1 killer for both men and women. In fact, 1 in 4 deaths in the United States are attributed to heart disease. In fact, there is one death in every 36 seconds that's attributed to heart disease. And we know that almost 660,000 people die each year of cardiovascular disease. So this is a very important thing. And we believe that a healthy lifestyle really does lead and means a happy heart. So we're going to get talking about that. So let me see if I can get my other guest on.
Dr. Itchhaporia, we can see you.
Yes, we're both here.
Okay, great. All right, so you guys are there. I can finally see you. So why don't we first start talking about the first habit or sort of lifestyle change we can make? How about managing blood pressure? So maybe we can I see my next slide, managing blood pressure? So I will start with Dr. Blankenbaker. Tell me what you think about, what you tell your patients. Why is blood pressure such an important thing?
Well, blood pressure is one thing that we can all measure at home. So it's certainly something you can track yourself. So it's very important, I think, for patients to take charge and measure their own blood pressure. And I think it's important to know what your goal blood pressure is. For most patients, we are now recommending a goal blood pressure of 120/80 or lower. And we know that by getting those blood pressures down even further, it has a big impact, not only on heart attack, but stroke, kidney disease, and other issues. So I think it's something that is very, very common. I tell most of my patients, if you have normal blood pressure when you're younger, there's a good chance you're going to have high blood pressure as you age. So I think it's something that people need to continue to monitor for. And not only, you know, medications is one of the way we treat it, but also dietary changes. There's a diet called the DASH diet, DASH, that's been shown to reduce your blood pressure substantially just by dietary changes alone. And exercise is also an excellent way to lower blood pressure along with weight loss. And the exercise changes in blood pressure can be, the patients can see it themselves. If they take a brisk walk and measure their blood pressure 30 minutes later, they'll often see it's substantially lower. So those are things that you can track every day. And you know, by staying on top of it, it makes a big difference in your risk of both heart attack, stroke, and other issues.
So let me go to Dr. Bassi. So Dr. Bassi, let's talk about blood pressure. You know, it is a silent killer. And I think Dr. Blankenbaker touched on the fact that low salt diet can help, exercise can help. Talk to me a little bit more about that. What's your recommendation in terms of how much salt somebody should eat?
Yes, well, it's a great question. And you know, one of the things, the original studies, they pointed out, it's not just your sodium intake, but it's also your balance between sodium and potassium. So a lot of people really focus on limiting their sodium, but if they're not eating enough potassium, oftentimes their blood pressure is still not well managed. So what we recommend is for most patients, you know, you want to try to stay under about 2,000 or 2,500 milligrams of sodium, but you also want to have a lot of potassium in your diet, you know, upwards of 3,000 milligrams. Now, of course, if you have renal disease or kidney failure and there's other reasons why you can't have a high potassium intake. But it's really that sodium to potassium ratio that we really emphasize as how we would manage blood pressure. And examples of foods, everyone thinks about bananas as a good source of potassium, but also think about tomatoes and avocados, sweet potatoes, there's spinach, there's a whole host of natural foods with potassium. And so balancing out sodium, which tends to be in processed foods, oily foods, foods that we want you to stay away from, and eat more potassium, which is in fresh fruits and vegetables. That's one way that you can help lower your blood pressure.
Yeah, and I want to emphasize that you're not saying to everybody listening that they need to go out and buy potassium supplements. In fact, if that's what if you're hearing, that is absolutely not what we're doing. So I love the idea of all the foods that you mentioned as good sources of potassium. Also making sure you're not adding salt and avoiding those salty foods. Canned soups have a lot of salt, ham. I think that it's important to start reading labels so that you are really paying attention to how much sodium that you're eating. I think exercise, I've always told my patients that exercise will decrease your blood pressure 2 to 3 millimeters of mercury. If you watch your salt, that's an additional 2 to 3 millimeters of mercury decrease. So together, you're getting 4 to 6 millimeter decrease in blood pressure, which is sort of like a mild hypertension blood pill. So I agree. I think that we know high blood pressure is very common, and it's sort of the start of all these different cardiac issues. It is a silent killer, so it's extremely important that we actually take action in terms of that. Dr. Blankenbaker, any other comments with regards to blood pressure that you want to add on?
Well, I think people need to understand that the vast majority of people, we always recommend lifestyle changes, but for most people, they probably will end up needing some type of medication to help lower their blood pressure. And, I don't want people to think of having to take a medication as a failure. It's a way to keep yourself healthy. There are many medications for blood pressure out there today. A lot of them have minimal side effects, and they actually have some secondary benefits and may help reduce heart disease in other ways. So I think for most people, if their blood pressure is substantially elevated, medication may be very beneficial, but I think it's not something to shy away from. I think it's something that's going to definitely keep you healthier in the long run.
Right. So you got to exercise, you got to follow the low salt diet, but if it doesn't work, it's okay. But tell me when you would start the blood pressure medications.
So our goal is to get your blood pressure to 120/80, but we don't typically start medications until the systolic blood pressures are starting to average above 130. And I tell people, check your blood pressure in the morning. That tends to be when it's highest. Maybe about 30 minutes after you've been up before you start your day, check your blood pressure. If you're consistently getting systolic blood pressures over 130, despite your diet, your exercise, that's the time when I would start blood pressure medications.
Yeah. And, I will differ a little bit with you in the sense of checking the blood pressure all the time, because I think there are certain personalities that may not be all that. If it makes them anxious, then I would say don't check your blood pressure, but make sure your doctor checks that blood pressure. And I agree, when it's consistently over 130/80, we think about starting medications. The younger you are, sometimes the lower blood pressure, the lower number gets higher. As you get older, the top number will also go up. So I think that's important. Let's go on to another lifestyle change. The next slide, which shows us about getting active. So I think this is really important. So Dr. Bassi, do you want to start off this conversation about activity? What do you recommend to your patients about how much exercise they need, what exercise to do?
Absolutely. I think, I always tell my patients, and my patients who are listening today, they probably heard me say this, but exercise and something as simple as walking is really the fountain of youth. Keeping your blood circulating, do something that you enjoy, something that involves movement. That's the key. It could be going out for a walk. It could be swimming, riding your bike, doing a dance class, exercise classes. Do something that you enjoy, that is something fun, something physical, and it's good for your mind, your body, and your spirit. In terms of how much exercise, the ACC-AHA, now that's the American College of Cardiology and the American Heart Association, puts out guidelines. And so they recommend at least 150 minutes per week of moderate intensity exercise, or 75 minutes per week of vigorous intensity exercise. And so, a good rule of thumb is about 30 minutes a day. If you really want to simplify it, 30 minutes a day where you get out, you move, especially, those of us who are watching here in Southern California, and we're blessed with such nice weather, go outside, get some fresh air, get some sunshine, and get a workout in. And I guarantee no matter what mood you were in beforehand, you're going to feel so much better when you're done with your workout. And you can feel confident that you're doing something great and important for your heart.
Dr. Blankenbaker, talk to me a little bit about exercise also. Tell me, how can you be sure that your exercise is the right intensity level? Does that matter?
Well, most of the studies have shown it only has to be moderate intensity. So we're not talking about, running marathons and doing extreme workouts. In fact, the studies have shown there's not any greater benefit to doing some of these extreme exercises. It's just moderate intensity, which would be something like a brisk walk, a bicycle ride where you're continuously pedaling. So swimming, those are the type of things that people need to be doing. They don't have to be focused on, hey, I can't go to the gym and, stay on the elliptical trainer at the highest speed for an hour. It doesn't have to be that extreme to get the benefit. So I really encourage people to do things they enjoy. And I know a lot of our patients have orthopedic issues, back issues. Try to find something like swimming, water aerobics, recumbent bicycle. There's lots of different ways to exercise. It really doesn't matter how you exercise. It's just the fact that you get out there and do it and get your heart rate up. And that's where you get the benefit.
Yeah. So, it's interesting because I've always told patients that it's not about the intensity, but it's about the consistency of exercise. So I agree with both of you. It's really important to do exercise. I don't think it matters the intensity. In fact, there was a study out in the New England Journal of Medicine as early as 1981 that said that if you do 30 minutes of walking, so they compared walking versus somebody that did strenuous exercise. And what they found was that they all benefited from a cardiovascular standpoint. But where the difference was is the people that did the high intensity were in a higher fitness group. But in terms of cardiovascular mortality reduction, the chance of you dying from heart disease was similarly appreciated by all of the groups. So unless you're trying to get into the high fitness level for some reason, from your standpoint, my standpoint, Dr. Bassi's standpoint, we're all talking about exercise that will help your heart. So we're talking about 30 minutes of cardio exercise at least 5 days a week. It cuts your cardiac mortality 50%. So what about any other benefits or anything else that you tell patients about exercise? Either one, well, either Dr. Blankenbaker or Dr. Bassi. Anything else that you guys want to add?
One of the things as we get older, we're more likely to have falls. We're more likely to have other issues like osteoporosis, things like that. So doing weight-bearing exercises when possible, and actually walking is a weight-bearing exercise. So that is very important to strengthen your bones, strengthen your muscles, increase your coordination, and then also think about flexibility. Yoga, Pilates, stretching. These are things that you can do to help minimize your risk of falling.
Yeah, I totally agree. The resistance exercise is extremely important. They say that it helps decrease metabolic syndrome if you can do some resistance training. So low weights. I think it's really important. That old adage that if you can get off the floor alone by yourself, that means that you've got good core strength. That becomes a really important thing. And I can tell you, I'm a real cardio person, so I do cardio, but the resistance training is much harder. So it takes a lot of discipline. But I will tell you that if you want to maintain good weight, good overall health, you have to be able to do some resistance exercise. So. Dr. Blankenbaker, anything else you want to add?
I would just like to add that, in my practice, I see a lot of different patients, and the patients that commit to exercise and do it consistently age so much better. They maintain their independence longer. They're able to travel. They're able to do things for much longer and much later in life than the people that don't exercise. So it's important to start early. Start in your middle ages, start earlier as early as you can, but getting that fitness level and maintaining it is the secret to really maintaining an active lifestyle.
All right. So we've talked about high blood pressure, and actually there's a couple of questions that have been coming in, And so I kind of want to, before we go on to our next sort of habit that we're talking about, somebody said, my blood pressure varies quite a bit throughout the day. What's a good time to take it and standardize? And I think Dr. Blankenbaker mentioned that about doing it in the morning, say after sometime at the breakfast table is good. And then at nighttime. Do either one of you have any other suggestions about what's the best time to take the blood pressure?
Well, that's a common consult that we get. My blood pressure keeps fluctuating. What do I do? And what we tell people is there's a natural circadian rhythm to your blood pressure. So it is normal for your blood pressure to fluctuate throughout the day. Think about if you did a workout, or maybe you drank some coffee, or maybe you're stressed out, maybe you were stuck in traffic, all of these things, and then you check your blood pressure right after, maybe you ran up the stairs. All of those things is going to affect your blood pressure. So if you check it around the same time in the morning after you wake up, to me, you're eliminating a lot of those variables. And that's why I recommend for my patients to check their blood pressure in the morning. And that's the number we're really going to target.
Yes, and I agree with that, because I've actually seen patients cause their blood pressure to go up by being overly obsessed with checking it. Check it once a day, write down your reading, and then forget about it for the rest of the day. Because your blood pressure will definitely fluctuate, and that's okay. Our blood pressures are designed to go up and down. That's a normal response. But what we see that really causes heart disease and stroke is if you have a consistently sustained blood pressure that's high, and if you check it every morning, that should definitely, checking it once a day should be enough to tell us whether you have a consistently high blood pressure that needs to be treated.
I also like to say that if you're going to check, when you check it in the morning, don't check it as you're still in bed. Some people think that when they first wake up, they're so relaxed that it should be, but that's actually one of the higher blood pressure. So it's better once you get up and go to the breakfast table and you're sitting, because when you first wake up, the adrenaline rush will make your blood pressure be a little bit higher. There was a couple other questions. One was, what's the ideal blood pressure range for seniors? I go back to what Dr. Blankenbaker says. We still want blood pressures to be 130/80. I think once you start getting over the age of 80, we sort of maybe accept a little bit higher blood pressure, somewhere between 130 and 140. But ideally, we want your blood pressure to be 130/80 in general. And then the last question was about, is there a genetic component to hypertension and high blood pressure? So this person said, my grandmother, mother, sister have hypertension, and they also have had it for 10 years plus. Is this genetic? Absolutely, there's a genetic component. So do either one of you want to speak on the genetic component about high blood pressure?
I think it's important to know your family history. Whenever you meet with us, or you're a cardiologist or your primary care doctor, one of the things we're going to ask you is tell us about your family, because a lot of these things do run in the family. And so to know your family history is very important. So we can basically plan ahead, and we can keep track of these things early, keep track of your blood pressure. If we're going to get to cholesterol, if you have a family history of high cholesterol, these are things to know about, because knowledge is power.
So let's go on to our next one, controlling cholesterol. You sort of gave us a segue for that, Dr. Bassi. So controlling cholesterol. So we know that cholesterol is a bad actor, and it can affect us. But let's first talk about the lifestyle issues that can help cholesterol. And then what are the numbers that we're targeting? So actually, let's start with you, Dr. Bassi, since you brought up the cholesterol issue.
Yes. So in terms of lifestyle, and you'll find a common pattern as we go through all of these themes, and that is that lifestyle is the foundation. Now, oftentimes it's not enough, but it's the foundation, and that's why we always start with that. So the basic building blocks, in terms of diet, you want to make sure that the three biggest culprits of cholesterol is going to be red meat, egg yolks, and full-fat dairy like cheese and ice cream. So those are three big sources of cholesterol in your diet. So make sure you watch that. Secondly, exercise, maintain a healthy weight. These are all very, very important elements as well. And then the third is, know your family history. Some people have genetically very, very high cholesterol, and it's never too early to get it checked. If you have teenagers, they could get their cholesterol checked. If you have kids in their 20s, or maybe you're watching and you're in your 20s, it's good to know what your numbers are, because basically the cumulative effect of cholesterol over time is in many ways like smoking. If you smoke for 30 years, at first, maybe you don't feel anything, but it takes a toll on your heart. Same thing with cholesterol. So even at a young age, especially if you have that positive family history, to know what your cholesterol is and to make sure it's well managed will pay large dividends down the road.
So Dr. Blankenbaker, talk to us about the numbers. What are the numbers that you talk to your patients about with cholesterol numbers?
One of the things that I help me to determine what our goals for cholesterol or what the other risk factors are. So certainly someone that's older, has a family history of heart disease, maybe high blood pressure, maybe diabetes, our goal is going to be much lower for that person than someone who is, younger, normal weight, no blood pressure issues. So one of the things we want to first look at is what are the other risk factors. But in general, we like to see our LDL or the bad cholesterols less than 100 for the average risk patient. And for those patients that are really high risk, someone that's had a heart attack, someone that's diabetic, someone that's had a stroke, those are people where we want to target an LDL level of less than 70. And in some instances, we may even be looking at trying to target LDL levels less than 50. So I think our goals are definitely going to depend on a patient's risks. And that's one thing we definitely evaluate when we see a patient in consultation is, what are our goals for cholesterol and how can we get there?
Yeah, so I agree with you. I think that everybody should at least have an LDL cholesterol of less than 100 and then less than 70 or even lower if they've got heart disease or they've had a stroke or they're in the high risk group, like you said. The total cholesterol we try to target is less than 200, and the HDL, which is the good cholesterol. And I always remember that because the G is close to the H. So good cholesterol, the HDL should be at least over 40, ideally over 60. But again, the HDL is hard because the only thing that really impacts is cholesterol, is exercise. So again, it goes back to what Dr. Bassi said. Exercise is extremely important. Diet is you can dietarily impact the LDL more, but it's hard to impact the HDL dietarily, except for sugar. The more sugar you eat, the higher your sugar is, the lower your good cholesterol is. And then of course, triglycerides, those, we want those less than 150. And those are really going to go up if you eat too many sweets, carbs, so white bread, potatoes, pasta, rice, or alcohol, because those are big factors. So talk to me about, when you talk about diet, talk about alcohol a little bit too. How does that impact your cholesterol? I heard that it was supposed to be good for you. Is it good for you? How should they moderate? Start with you, Dr. Blankenbaker.
Well, there are some studies that have shown that alcohol may raise your HDL, but I don't specifically recommend that because, too much alcohol has lots of other negative health risks. But if somebody enjoys, say, a glass of wine with dinner, I think that carries a very low risk and may impact your HDL, but I certainly don't recommend that as a treatment because, one, you get a lot of calories with alcohol. Two, as you mentioned, it can affect your triglycerides and blood sugars. So too much of a good thing will definitely cause more problems than it solves.
Well, and I'll let Dr. Bassi weigh in just a second as we talk about the next, and you could bring in the alcohol piece with the next slide, which is about eating better. That's our next sort of lifestyle thing, because diet is obviously quite important. So I think eating better is something that we always suggest to our patients. And we sort of talked about that with the salt and exercise and all that. But Dr. Bassi, do you want to talk us through the diet piece of it? And if we can get our next slide.
Absolutely. Well, before I do that quickly, sometimes, people will come and they'll say, well, I have a high HDL, but I also have a high LDL. So does my HDL cancel out my LDL? In other words, does my high good cholesterol cancel out my high bad cholesterol? And the studies are very clear that the number one most important predictor of developing heart disease or a stroke is your LDL. So unfortunately, having a high HDL level is not protective if you have a very high LDL cholesterol. So I wanted to really make that point. And
well, that's a really good point. And actually, why don't you take us through what are some of the foods that may be good for your cholesterol, that may help your cholesterol?
Yes. So, and that gets us to this right here. So eating a whole food diet, I always tell people, if you look at the back and it's got a list of ingredients that's, in size 4 font, it's probably not something that's going to be good for you. So the more natural foods you can eat, whole foods you can eat. And what do we mean by that? We mean lots of fruits and vegetables. And Dr. Itchhaporia, you've really turned me on to that about eating more vegetables. And I've tried to incorporate that, and it's made a really big difference. So I think that's the foundation. Number one. Number two, fish. Fish is, for those who do eat meat or fish, fish is a lot healthier for you than red meat or pork. So we recommend fish. Now, I always tell people, you want to stay with the low mercury fish. So tuna and swordfish are very high in mercury. So I would really try to avoid eating those fish, or if you do eat them, eat it very sparingly. But salmon and halibut tend to be lower in mercury. So, fish is good for you, and lots of fruits and vegetables. And then the things you want to stay away from are processed foods, and you want to stay away from, foods that are, have a lot of added sugar, preservatives, things like that. And then one other thing that people ask sometimes is, what about fat? There was a movement, in the United States in the 80s and 90s where everything was low fat or no fat. And is that good? Well, the studies have actually shown that there's certain fats that are actually good. Avocados, nuts, and olive oil are 3 really good sources of fat. So they actually did a study where they looked at over 30,000 patients in a couple of cohorts. And those patients who ate more olive oil, and what did they mean by that? Was just a half tablespoon per day. And that could be divided throughout the day. When they ate that rather than butter or margarine, they had about a 30% reduction in developing cardiovascular disease. And so although olive oil is a fat, it's actually a much healthier fat than some of the other ones, such as, vegetable oils, margarine, and butter.
So Dr. Blankenbaker, I know Dr. Bassi just talked us through the diet and really a good overview of the diet. Are there other dietary recommendations that you make to your patients that we haven't covered?
One of the things I definitely like to emphasize is how important, the whole grains are. And other things like legumes that can be substituted for meat. You don't have to eat meat with every meal. There's lots of non-meat options, which are really healthy, have lots of protein, but they don't contain the unhealthy fats. So I think, for instance, oatmeal has been shown to lower your cholesterol. And if you add nuts and berries to your oatmeal, you're getting an excellent source of not only are you lowering your cholesterol, you're getting an excellent source of potassium and other nutrients. So I think it's important to eat a variety of foods, but fresh foods, not processed foods. If it comes wrapped in plastic, it's probably not good for you.
Yeah, that old saying, you are what you eat, is so true, right? So, and then I think that it's important to, like, for example, if I eat oatmeal, I even put a tablespoon of flaxseed meal because it's rich in omega-3s. And what I love about thinking about fish, I don't eat fish, but if you eat fish, it has a lot of omega-3s, which helps decrease inflammation in the body. And then in terms of, fresh fruits and vegetables, some people say, well, my sugar gets high if I eat too much fruit. So then temper that, but still eat fruit. Why? Because it's got a lot of antioxidants. And I think that sugar is a little bit different than the sugar that you eat if you eat candy and, other sweets, for example, or simple carbs. When we talk about carbs, I'm vegetarian. So of course I eat a lot of carbs, but I tend to eat whole grain carbs. So it's a little bit healthier carbohydrates rather than eating all the white stuff, which I think is not as healthy. I tend to eat. Now, what's the difference between vegan and vegetarian? Because I always tell patients I'm vegetarian. Vegan means that I would not eat any animal-based protein. So because I drink milk, I eat a little bit of cheese, occasionally have a yogurt. I'm not considered vegan. I'm vegetarian. But if you're vegan, you would not even drink milk. You would, not eat eggs. Or anything that's animal protein. So no butter, nothing like that. Now, there are a lot of studies about plant-based diets that said that really helps with heart risk. But, I think everybody has to sort of find their happy medium with what they do. But overall, I think generally we're all in agreement that a healthy diet is extremely important. Dr. Blankenbaker, tell me about keto. Tell me what your thoughts are about the keto diet. People ask us about the keto diet. What's a good diet to go on? if I want to try to lose weight?
Well, my feeling on keto, a lot of patients can lose weight quickly, but they almost always gain the weight back immediately once they go back to a normal diet. So I'm not a big fan of keto. I've seen some really huge increases in LDL cholesterols from people that are eating really unhealthy meats. So I tell people it's great if you want to reduce your carbs and replace it with healthy proteins. But going to the full keto, I think, is one, not sustainable, and two, is not going to lead to a healthier lifestyle in the long run. So we use it in extreme cases. If somebody really has to lose weight loss quickly, maybe for a surgery or something really important, but I don't feel it's something that most people can sustain for the long run.
Does Dr. Bassi want to add anything about the keto diet or any other diets that you recommend to your patients?
The Mediterranean diet is a really good diet, and actually the largest study, as far as I understand, is a study called the Predimed study. This looked at thousands of patients, and basically what it showed is the Mediterranean diet that was rich in lots of fruits and vegetables, and then there were two groups that were basically randomized to olive oil and nuts, and those patients really did well. So the diet that I recommend that's balanced, and it's also, hey, let's face it, it's also delicious. And so I think the Mediterranean diet is an excellent diet. One other quick comment, Dr. Itchhaporia, you mentioned about fruit and sugar. A lot of times, folks will say, well, I drink juice. I drink apple juice. I drink orange juice. Isn't that fruit? Aren't I being healthy? And what we tell people is if you're worried about spiking your blood sugar, which can, eventually lead to weight gain, drinking juice is not the way to get your fruit. It's much better to eat a piece of fruit. It's better to eat an apple than to have a glass of apple juice. Why? Because the apple has a lot of fiber in it, and the fiber will bind some of that extra sugar up. So we always recommend it's better to eat a piece of fruit rather than drink, fruit juice, as delicious as that may be.
Yeah, and it goes back to the juicing, right? Everybody wants to juice everything, and some things are good. The green juices are good, but sometimes I agree you need those antioxidants. You need the fiber that's in eating the fruit that really comes through a little bit more when you're eating the whole piece of fruit. But again, you did a great job of segueing us to the next slide, which is about losing weight, because I started asking about the keto diet, but you mentioned some of that. So since you're still talking about it, why don't you talk to us about losing weight? What do you tell your patients about what's the right weight, losing weight? What are some things that you sort of counsel your patients on?
So a few things. Number one is, your weight is going to help in so many areas. We're focused on your heart, but it also, maintaining a healthy weight will be important in terms of preventing diabetes, fatty liver disease. There's a whole list of diseases that you can prevent by maintaining a healthy weight, number one. Number two, and it's simple and it's not a perfect metric, but your BMI. If your BMI is more than 25, you're overweight. And if it's more than 30, that's in the obesity category. So when we're looking at your weight, we are looking at the BMI. And again, that's not perfect for everybody, but that's a good rule of thumb. The other thing I would say is it's not only what your weight is, but where is it distributed? The abdominal obesity is particularly dangerous. That those fat cells are releasing pro-inflammatory hormones and other things that can lead to heart disease. And that's really being mediated by insulin release from eating, a lot of carbohydrates, alcohol, things like that. So it's not only what your weight is, but where it's distributed. And if it's abdominal weight that's been deposited in terms of fat, that's something that we're particularly concerned about, and we want to work with you to help improve.
So Dr. Blankenbaker, tell me about what are some of the counseling that you give when patients need to lose weight. What do you tell them is the ideal body mass index, and how do you coach them into losing weight?
Well, I agree with Dr. Bassi that the body mass index is very important, and you can plug your numbers into a computer and it'll give you your body mass index. And I too agree that 25 or less is where we're trying to shoot for. So one of the things I tell my patients is I have a lot of patients that say, I don't eat anything and I continue to gain weight. And I say, it's impossible. your body burns a certain amount of calories and you take in a certain amount of calories. What you have to do is find where that balance is. And it may be very different for different people, but for some people, they may only need 1,200 to 1,500 calories a day to maintain their weight. And to lose weight, they're going to have to get below that. But the only way you're going to know that is to track what you're eating and how many calories. And you have to count everything. You eat snacks, you eat, a piece of candy. All those things add up during the day. So I think a lot of people don't realize how many calories they're actually ingesting until they actually put it on paper, write it down, and understand how many calories they're getting. Most of your weight loss is going to come through calorie reduction, but by exercising, you will burn more calories. And that's not going to be a huge part of weight loss, but it's definitely going to help. It's going to give you a downwind, so to speak. So those are one thing that I think is very important, is for people just to understand how many calories they're actually consuming every day.
Yeah, no, I agree with both of you. I think that, there's no way you can lose weight without doing two things. One, eating less, as well as exercising. I think if you just do one, it may not be enough. You need to do both. And even when patients say, I don't eat anything, I say, well, whatever you're eating is too much. So that means you have to decrease the portions. And I think we really have an issue with portion control, particularly in the US. We've gotten used to, everything is mega sized. So I think whatever, and I say to patients, you know what, cut down on the portion. 50% reduction is better than 0%. So, you can eat most things, but at least cut them down. So I think that's really, really important. I agree with the BMI being less than, the 25. One of the other things that has worked for a lot of patients is this intermittent fasting issue. So what that means is to, eat basically 2 meals a day, right? So you eat your last meal, and then the next meal after that could be anywhere. I would say after 12 hours, ideal would be 14, 15 hours. Some people have done 16 hours. And if they can do that and really just do those 2 meals a day, then that has been another thing that's been effective, is this intermittent fasting. I definitely think cutting down on the carbs that you eat, and so for those people that are eating meat, I would say eat, the fresh fruits and vegetables, but eat some meat, protein, and try to eat a little less carbs. That will make a difference. So I think the calories really matter. I think exercising matters. Oh, and sleep, sleep is really important. I think if you're tired all the time, I think your adrenaline is running high, and I think you tend to be more hungry. So I think if you sleep, then it's easier to lose weight. And then I will say lastly that I do think, again, going back to the point about the weights, the load, you have to do the resistance training if you want to lose weight. Cardio alone is not going to be enough. And ideally, what would be nice is if you can walk after you eat every meal. So particularly in the evening, we tend to eat our heavy meals during the evening, and then we all sit. So it's nice if you can eat and maybe go for a short walk, even if it's 5 or 10 minutes, but I think it's better than just sitting. So I don't know if either one of you have any other thoughts that you want to share before we go on to our next one other lifestyle habit that we can change.
I would also emphasize what you drink. So a lot of people are drinking sodas. If they're drinking coffee, they're putting in a lot of sugar in there, and alcohol. So one thing I really emphasize is, hey, let's make sure that what you're getting in terms of what you're drinking is pretty much 0 calories. Oftentimes people will lose 5 or more pounds just making that change. So drink a lot of water. I think a lot of people are just chronically not drinking enough water, and they feel a lot better. We have patients who feel lightheaded, and that gets better, or they have headaches and that gets better. So drink a lot more water and drink a lot less of the soda, the sweet drinks, the special unicorn frappuccino at Starbucks, the 2 glasses of wine, at night. All of those things are, the liquid calories are oftentimes what sneaks up on people. So when they say, hey, listen, I'm eating healthy, but what are you drinking? Because that could be a real, impediment to you losing weight.
I think that's an excellent point. And a lot of patients say, well, I only drink 2 drinks. Well, first of all, if you're going to drink every day, I think 2 drinks is too much, because there's a lot of empty calories in there. There's a lot of sugar. Most of those people will have sugars that are elevated. That can bring your good cholesterol down. So, and then I think for women in particular, moderate alcohol is one. per day, with occasional two. So I think that's an extremely important point. I'm going to give one to Dr. Blankenbaker. We got a question, and what's your opinion on kale juice as a protection against type 2 diabetes, heart disease, and high blood pressure?
Well, I think there's a lot of, there's a tendency to want to find a magic bullet like kale juice or beet juice or something, but it's really, there is no magic bullet. It's what you eat every day, day in, day out, that makes a difference. So kale juice, sure, it may be fine to have once in a while as something that you enjoy, or maybe something that has a lot of nutrients, but it's not a magic bullet. It's not going to cure diabetes. It's, if you have kale juice and then go eat a bowl of ice cream, it's done absolutely nothing for you. So it's really about the whole package, not just one particular food.
I agree. Dr. Bassi, you talked about hydration, and there was a question about, can staying hydrated keep you from having a heart attack?
I don't know if it's specifically, I don't think there's been a causal link necessarily that's, that direct between staying hydrated and preventing a heart attack. But I think indirectly, staying hydrated is so important. So here's what I tell my patients. When you wake, and this is assuming that, you're otherwise pretty healthy, you don't have, kidney failure or heart failure or something like that, is when you wake up in the morning, drink 2 glasses of water, first thing in the morning, before you have your first sip of coffee or anything like that. When you wake up, you're dehydrated. You've actually been losing fluids just through sweat and evaporation while you've been sleeping. You obviously haven't been drinking any water while you've been sleeping. And then if the first thing you drink is coffee, that's a diuretic. So drink water first thing. You'll start your day off on the right foot. And then when you do exercise, you implement some of these recommendations as we've been discussing, and you start exercising, and maybe you work up a sweat. That's extra important to stay hydrated. So I think hydration is one of the most important things you can do, not only for your cardiovascular health, but I think you'll feel better as well.
Yeah, and it certainly does not prevent you from having a heart attack, but I think it's one of the healthy habits that we've been talking about: exercising, hydrating, working on weight loss, targeting this salt, and eating a healthier diet so you have less high blood pressure and cholesterol issues. Maybe we can get our next slide and go into the one of the next habits, which is about smoking. So we know that smoking is the #1 modifiable cause of death, right? And so talk to me, Dr. Bassi, about smoking. What do you tell your patients about smoking and how to quit smoking and how bad smoking is?
So first of all, smoking leads to heart disease. It leads to strokes. It leads to cancer. It leads to emphysema. And one thing, we have folks who say, but I've been smoking my whole life. I've been smoking for 50 years. At this point, why should I quit? And what we tell people is the data shows us that it doesn't matter how many years you've been smoking. The year you quit, you drop your risk of a heart attack or stroke in half. So it's never too late to have a plan, have a strategy, work with your doctors, and quit smoking.
Dr. Blankenbaker, I'm going to ask you a question because there was somebody in the chat had said, my HDL is really low. Is there a risk of having low HDL? But how does that low HDL and smoking, can you talk about those two?
Well, smoking is definitely one of the causes of low HDL. That inactivity. So yeah, smoking is very important. And not only is smoking, I call it a multiplier. It doesn't just double your risk, it's an exponential increase in your risk of heart disease. So if you, for instance, are diabetic, have high blood pressure, and add smoking on top of that, it's not just a doubling of your risk, it's a tripling or quadrupling of your risk. So smoking is a multiplier of all your other risk factors. So the more risk factors you have, the more dangerous smoking is. But even for someone that has very little risk factors, smoking is one of the easiest, it's not the easiest thing to quit, but it's one of the easiest things to modify in terms of turning around your risk very quickly. It's, as Dr. Bassi said, it's almost an immediate benefit.
Yeah, I agree. And I think that one of the interesting things is that young women are starting to have more heart disease risk than ever before. And one of the associations was the fact that more younger women are smoking. And if they smoke and take birth control pills, their risk of stroke and heart attack just exponentially goes up. So we do think smoking is a bad actor. And I agree, it does bring down that HDL. And, really the HDL can be brought up if you exercise and you stop smoking. And there is a higher risk of heart disease if you have a low HDL. So especially those patients, those are the patients that I say, get on the omega-3s, exercise every day, make sure you don't smoke. So you can get your HDL up as high as you can get up. Let's go on to our next habit, next slide, which is about reducing blood sugar. And I think we've touched on this a little bit already. So Dr. Blankenbaker, tell me about what is normal blood sugar and what do you tell your patients about how to decrease their sugar levels?
Yeah, so I think, blood sugar is one of the things we're learning over time causes a myriad of issues, not only heart disease, but as Dr. Bassi said, fatty liver. It can cause a lot of different things. And what I think as our dietary changes have been to a much bigger push away from the foods that are high in carbohydrates. Because carbohydrates, things like bread, rice, they break down almost immediately into sugar. So it's almost the same thing as just eating refined sugar like you would get out of, cane sugar. So I think foods that are really high in sugar are something that we definitely need to reduce in your diet and replace it with either complex carbohydrates or proteins. So I think we're really learning more and more about the role sugars has in inflammation, which we think may accelerate your risk of heart disease. Certainly diabetes, we know is a much higher risk of heart disease. So in terms of monitoring blood sugars, though, we often will do a check called a hemoglobin A1C. And I think that's probably the best way to really understand your blood sugar. So anybody, under 5.6, we usually consider that normal. There's kind of a zone between, depending on which lab you're looking at, 5.7 and 6.4, which is prediabetes, which is actually also an increased risk for heart disease. And people with the hemoglobin A1C over 6.4 are definitely in the diabetic range and much higher risk for heart disease. So I think, as part of your annual physical, most people usually have a hemoglobin A1C checked, particularly if there's any family history of diabetes. So I think it's really important that you know what your hemoglobin A1C is and you make steps to reduce that.
Dr. Bassi, tell me, is there anything else that you'd like to add to that?
Well, just to actually sort of tie into something that you said earlier, Dr. Itchhaporia. So, and that has to do with exercising after meals. So when you eat a meal, the blood sugar and, level in your blood is obviously much higher. And so what happens, how does your body deal with that higher blood sugar? Well, it's going to release a lot of insulin, and then that insulin will store that as fat, and it typically stores it as fat along the midsection. And that raises inflammation, as Dr. Blankenbaker mentioned. A lot of times plaque is a combination of high cholesterol and inflammation. So one of the best ways you can actually reduce your blood sugar is if you do eat a meal that tends to be higher in carbs or tends to be maybe have a little bit of extra sugar, is go for a walk afterwards. Go for a walk for even 10 or 15 minutes. Your muscles will use up some of that extra blood sugar before it allows itself to be stored as fat. So that's why we say it's not only what you eat, but also how much you exercise, especially after meals.
Yeah, I think that, number one, choosing the right food so that you don't have the high sugar. So it means obviously sugary foods have high sugar. So you want to try to avoid some of that stuff. But also I agree, a little bit of exercise, choosing the whole grains will make you have less of the high spikes in the sugar, trying to avoid eating a lot of just sugary things, drinks, as well as candy and desserts and all that. We all want to eat that. But maybe what we could do is eat a little bit of it so we still get a taste, but not get our sugars to spike. So we really talked, we talked about simple 7 things, right? And we have a bunch of questions, but we talked about, eating healthier and managing our blood pressure. We talked about getting active. We talked about controlling cholesterol, eating healthy. We talked about losing weight. not smoking, reducing the blood sugar. These are just simple 7 things that we can do. But are there other things that you guys can think of that you want to share before we go on to our questions? We don't have a lot of time left, but we certainly have some questions from the audience. So anything that you want to add, Dr. Bassi, and then I'll go to Dr. Blankenbaker, and then we can go to our questions.
Sure. Just a quick closing thought, which is this is an investment. So the way to think about it is, are you willing to invest a little bit of time and a little bit of effort now for the rest of your life? Or are you going to invest a lot of time and a lot of money down the road after you've developed some disease? So this is why we say a small investment now will pay huge dividends down the road.
Absolutely. You know what, you just hit on a really important thing, which is that if we talk about health care, it's about when you're well. We don't want to do sick care. We want to do health care. And so that is making all of these lifestyle investments. Dr. Blankenbaker, any thoughts that you have? Any closing thoughts?
Well, I think it's really important that the choices we make, the little choices we make every day add up. For instance, you may go out to a restaurant and, you see a prime rib or, a ribeye steak on the menu, but there also may be a healthier choice like Chilean sea bass or salmon on the menu. Make the healthy choice more often than not, and you're going to live much healthier. And it could be other things. Use wheat bread versus white bread. Eat brown rice versus white rice. It's all of these little choices we make every day that eventually add up and help and really improve our health. And as Dr. Bassi said, it's an investment for your future.
Absolutely.
It's much easier to prevent heart disease than treat heart disease. Believe me, from someone that sends people to bypass, does stents, I would much rather see you never end up in that place in the first place.
Agreed. So let's go through some of our questions. So somebody sent in a question: if your cholesterol HDL ratio is good, does that help your high LDL? And I would say the answer is it does help, but it's not enough. You still want the LDL cholesterol to be less than 100. You still want your HDL to be over 40, your total cholesterol to be 200. But I don't think that the ratio makes up for a LDL that's high. And I think everybody's in agreement with that.
Yes.
So unless you want to add something else to that, I think we can, we already, now does the exercise recommendations that we talk about differ in someone that's already been diagnosed with heart disease? So somebody that's had bypass or a stent or anything?
So typically what we recommend is if you're pretty fresh right out of a bypass surgery or a stent, we recommend what's called cardiac rehabilitation, which is a supervised exercise program. So you're on the monitor and you're just gradually building up. And patients who do it, they love it. And at the end, they have a lot of confidence. They know exactly what they can do, what they should do, how far they should push themselves. And then, after that, it's like we talked about, which is building lifelong exercise habits. But doing it as part of a supervised exercise program right after a major, event like a bypass surgery or a stent in your heart would be a good first step.
Okay, then they asked, and I'll ask Dr. Blankenbaker about this. Somebody said, aren't plant-based meats higher fat level than red meat?
I don't know that it's higher fat, but the plant-based meats still have quite a bit of fat, and depending on what type of fat they use, it may not provide the health benefits everybody think it does. So, especially depending on how it's cooked, it may not be as healthy as advertised. So I definitely think it's something. It's probably healthier than red meat, but the benefits are not as good as, say, eating a fresh fish that, something that's not processed at all.
Anything you want to add, Dr. Bassi? No, but somebody also asked about whole foods, plant-based diet is good for, what's it good for?
Well, I think, there's a lot of research that if you really go plant-based and whole food-based and this kind of thing, that it's actually very good for heart disease, even in folks who already have heart disease. Maybe they have stents, they have bypass surgery, or maybe they've got, plaques that are going to, going plant-based is actually really, really good for you. Now, the one thing I always say is, well, what does plant-based mean? Because potato chips are quote, vegetarian, but that's not what we're talking about. What we're talking about is real fruits and real vegetables. and eating, basically foods as minimally processed as possible.
Right. And that's a really good point, because being vegetarian doesn't mean you're always healthy, because you could eat potato chips and pasta and all this stuff that's unhealthy. So it's about choosing healthier food choices, regardless of whether you're vegetarian or non-vegetarian. I think it's really choosing that. There was a question that came about hydration, and somebody asked, are there any sports drinks that you recommend while exercising? I know what you're going to say, Dr. Bassi. It's water, water, water. And I agree. But Dr. Blankenbaker, do you have any other,
Well,
answer?
if you're going to drink a sports drink, choose something low in sugar. That's the key.
Yeah, so low sugar Gatorade.
Exactly. Low sugar Gatorade. Just what you want to avoid is the sugar.
Yeah.
The electrolytes are fine, but some of the drinks do have more sodium than we'd like to see, but definitely avoid the sugar.
Yeah, the smart waters that have no sugar, that's good. Also, coconut water can also be that way. And then somebody asked about how often should a hemoglobin A1C be checked. Well, I assume you're checking it because you're diabetic, and if you're diabetic, then you may want to get that checked several times a year. I don't think routinely we check hemoglobin A1Cs unless your sugar is elevated, and then we'll check it. So it's hard to say how often. There are no routine hemoglobin A1Cs. It depends on what it is. So unless either one of you have anything else to add about the hemoglobin A1C.
Yeah, I agree. I check it. If somebody has an elevated fasting blood sugar on a routine blood panel, I would definitely check a hemoglobin A1C. If there's a strong family history of diabetes, I would also probably check one maybe once a year, just as part of a routine physical. If you're not diabetic and you've had a few hemoglobin A1Cs that are normal, you probably don't need to keep checking it every year.
There are two questions that I think are really important that came through. One was, my doctor keeps telling me that my LDL should be below 40. And is that healthy, since this person is saying the neurologist is worried about low LDL? Well, first of all, I think the neurologists are sort of on line with us that low cholesterol is good. In terms of the really low, I think Dr. Blankenbaker mentioned that if there are patients that are really high risk, then we do want those patients to even be lower than 50. I think if there's any discrepancy, to have the neurologist speak to the cardiologist so you can hear one voice. But comments from you, Dr. Bassi, you're agreeing with me. So what are your thoughts?
Well, two thoughts. So first of all, if you look at babies, they have a very low LDL level, and yet they are forming so many connections in their brain. The myelin sheets on those neurons are forming all kinds of millions of connections. And so there's just no evidence that having a low LDL level is detrimental, for example, for your brain health or something, which is sometimes what we hear. Secondly, there are certain communities, island communities, that have a very low LDL level, and they function just fine. They have a normal development. They're for all intents and purposes, they're just like everyone else. So there's no real evidence that having a high LDL level is in any way beneficial, or that having a low LDL is in any way harmful.
Yeah. Dr. Blankenbaker, this is a good question for you. What about aspirin? If somebody wants to know, yes to baby aspirin or no?
Aspirin, we used to just tell everybody a blanket recommendation to use aspirin, but that's changed recently because we realize there are certain side effects from aspirin. It can certainly increase your risk of gastrointestinal bleeding, and that itself has significant health consequences. So we don't routinely recommend aspirin for everybody now. Now, certainly if you've had a history of a cardiac event, you've had a stent, you've had a bypass, we continue to recommend aspirin for life. Also, if someone's had a stroke, we continue to recommend aspirin, or if they have peripheral vascular disease, like a blocked carotid artery. So there are certain populations where we're still going to recommend an aspirin for life. But if you're otherwise healthy, you don't have any history of any cardiovascular disease, we're probably not going to recommend aspirin unless there's some other risk factors that we find that may put you at much higher risk. So it's not a blanket recommendation for everybody to take aspirin anymore.
Yeah, and I agree, but I would say that if you have some risk factors and you're under the age of 70, it's safe for you to take a baby aspirin every day. And it's above the age of 70, unless you have a specific diagnosis, we don't routinely say prophylactically take it because of the risk of bleeding. So there is that age cutoff at 70, but I agree that, we target the ones that are the higher risk rather than a blanket statement of aspirin for everybody. So I think that we're at our end of our time. There were several other questions that we did not get to, but I really want to thank both of you for joining me and, for us to have this conversation. I think the take home message for all the patients is, really you can have a healthier heart if you have a healthy diet and a healthy lifestyle. And so a healthy lifestyle is what our mantra is. And I'll give a closing word to each one of you before we say goodbye. So Dr. Blankenbaker.
Yes, again, thank you for joining. The people that are watching this are probably those people that are going to go out and start implementing some of these changes. So we appreciate you listening in. But again, yes, I think it's as I said, it's not something that you're going to focus on for a week or a month. It's a lifetime change, and you have to look at it that way. You have to look at changing your lifestyle for the long term.
Yeah. Dr. Bassi.
Yes, well, thank you everyone for joining us, and thank you, Dr. Itchhaporia, for moderating this session, and thank you, Dr. Blankenbaker, as well. And it's easy to get caught up in the weeds and think about all this, but as one of my mentors, taught me when I was in medical school, it's very simple: eat smart, eat less, move more. If you do those three things, you can prevent heart disease.
Yeah. And what did, Benjamin Franklin said, an ounce of prevention is worth a pound of cure. So I think we're all in agreement. So we all wish you a happy, a healthy lifestyle and good cardiovascular health. Just follow those simple 7 rules of a good lifestyle changes. So thank you so much. And we wish you all good health.